Hello, my name is Shabir Hasham, and I'm the Global Program Lead for Puldysa, our investigational therapy for the treatment of respiratory dysfunction in DMD. I would like to thank the organisers for this opportunity to share with you this update and congratulate you on this enormous effort to bring this to an online forum, especially given the current circumstances. This disclaimer slide describes the inherent uncertainties within the clinical drug development process and the outcome of any potential clinical trial. The purpose of this presentation is to provide an update on the Idebenone clinical development program. Idebenone is not currently approved as a treatment in DMD and is under review by the European Medicines Agency. A decision on an approval is expected in Q3 this year. This presentation is not intended to promote the use of Idebenone in Duchenne. Clinical research has predominantly focused on the earlier stages of disease. By learning more about the natural history of lower limb function loss and the development of appropriate functional outcome measures to be used in clinical trials, so that a treatment is able to demonstrate a preservation of lower limb function and a delay in the time to loss of lower limb functional milestones, such as a time to loss of ambulation or transition to wheelchair. With improvements in standards of care, the use of steroids, and supportive measures including assisted ventilation, more young men are now entering their third or fourth decade of life. We therefore need to evolve our thinking in terms of the objectives of clinical research and to ensure that trials also investigate the potential benefits to upper limb, cardiac, and respiratory function. Such trials would also aim to demonstrate the ability of a therapy to maintain upper limb function or to delay the time to needing assisted ventilation, as examples. The natural history of respiratory function decline has only recently been well characterized, here shown in red from the Synergy Natural History Study. As respiratory muscles continue to weaken, we see a decline in respiratory function dropping below 80% predicted, a threshold that is generally regarded as abnormal and occurs around the time of loss of ambulation. Once below this threshold, respiratory function continues to decline in a linear manner until reaching a floor. To date, there are limited data that correlate respiratory function decline to clinically relevant respiratory outcomes. However, current care considerations use thresholds of respiratory function to identify the increased risk of clinical events such as an ineffective cough or the signs and symptoms of nocturnal or daytime hypoventilation. It therefore stands to reason that if a therapy was able to reduce the rate of respiratory function loss, shown here in this illustrative example in blue, that there would also be a corresponding delay in the time to crossing these thresholds of risk, such as, for example, the risk of nocturnal hypoventilation, therefore leading to a delay in time to needing assisted ventilation. The pivotal phase III DELOS study is the first study in an advanced DMD population in respiratory function decline. This study demonstrated that treatment with Idebenone led to a significant reduction in the rate of respiratory function loss as measured by peak expiratory flow, % predicted, and is still the only trial in DMD to have met its primary endpoint. We also observed a consistent treatment effect across a number of other respiratory functional measures, and as well as a reduced risk of bronchopulmonary infections, the use of antibiotics, and hospitalizations due to respiratory causes. In contrast, we now know that the use of steroids on respiratory function delay the onset of decline by 2 to 3 years, but once respiratory function declines below 80% predicted, the rate of decline is similar to patients who did not take steroids. In order to better understand the long-term effect of Idebenone treatment on the evolution of respiratory function, the SYROS study collected data from 18 patients who had previously completed the DELOS study and who received Idebenone under compassionate use or expanded access for an average of 4 years, and in some patients for up to 6 years in the real-world setting. The results of this study have recently been published. In this slide, I present one of the analyses conducted in the SYROS study. We compare here the annual rate of decline in untreated patients, shown in the gray bar, to the annual rate of decline in the same patients after long-term treatment with idebenone, shown here in the orange bar. Switching from off treatment to on treatment resulted in a reduction of 50% in the yearly loss of respiratory function. This study therefore provides further supportive evidence for a long-term treatment effect with idebenone. The phase III SIDEROS study aims to investigate if treatment with idebenone can benefit patients on steroids and is currently ongoing. It's a large study aiming to recruit 266 patients and is close to completing this recruitment target. Participants who complete the SIDEROS study and who are also eligible are offered the opportunity to participate in the SIDEROS extension study. The SIDEROS study is a randomized controlled study with a 1-to-1 randomization to either idebenone or placebo, and is not dependent on any underlying mutational status. Key inclusion criteria are that participants should be at least 10 years of age or older, willing and able to provide informed consent, and have an FVC between 80 and 35% at study start. Should be able to produce a reliable FVC value and be on a stable dose of steroid for at least 12 months at study entry, and have received appropriate immunization. I would like to acknowledge the fantastic contribution by families and healthcare professionals in Italy, and to thank you again for your continued support of this study. In summary, the loss of respiratory function ultimately results in the need for assisted ventilation and has a negative impact on the quality of life in patients with advanced DMD. The randomized controlled DELOS study demonstrated that idebenone slowed the loss of respiratory function outcomes. The SYROS study demonstrated the potential for idebenone to have a long-term treatment effect. But of course, further studies are needed to show that this reduction in respiratory function decline results in a delay in time to needing assisted ventilation. I would like to thank the families and healthcare professionals that continue to support and participate in clinical research. Your contribution is essential if we are to learn more about potential treatments for the benefit of the community. I would also like to wish you all well in these difficult times, and thank you once again for your participation.